What causes an overactive bladder?
That's a great question, and to this day, there are still many, many cases where we don't understand what's actually causing the problem. Overactive bladder affects over 30 million Americans, extremely common. You just about can't turn on a TV or pick up a magazine without seeing a gotta go type commercial. And it is that urgency, frequency, losing the urine on the way to the bathroom, you can't make it in time. It has a tremendous negative impact on patients' quality of life. Just as you said, they're afraid to go to church, they're afraid to go out to eat, they can't enjoy the activities. And while we have many medications these days that can help, and the medications really are designed to help the bladder muscle be less overactive, relax that bladder muscle. Now, why that bladder is misbehaving in the first place, in many cases we still don't understand, but we know that the bladder muscle is part of the problem. Some patients, in fact many patients, get tremendous relief from the medications.
Now, one doctor on the Dr. Bob show said there's no free lunch. Those medicines have side effects.
You're absolutely right. These are what we call anticholinergic medications. That's the class of medication they are. So while they relax the bladder, they are not specific or unique to the bladder. They can relax the bowel. That can lead to constipation. They can relax the sweat glands. That can make it difficult for a patient to sweat and therefore overheat when they're in the sun.
Blurred vision, dry mouth,
all those classic things.
Could it be a bladder infection?
It could be a bladder infection, and absolutely when somebody is being evaluated for the first time for these kind of symptoms, that's one of the many things that we look at the very beginning, because if there's any evidence of infection, that needs to be addressed right off the bat. But many patients it does not have to do with infection, and it has to do with typically one of two different categories. Either the bladder muscle that's misbehaving, and for most of those patients the medications are helpful, or it's the nerves of the bladder, the communication pathways of the bladder. And for those patients, they don't get adequate relief with the medications.
What can you do to help people?
For patients who are not getting adequate relief with medications, we begin to suspect that maybe part of the problem is the nerve or communication pathways. And what's so exciting is that we now have something to offer those patients. We can put in a little nerve stimulator. We call it a sacral nerve stimulator. Tiny little lead that goes down by the nerve that really most affects the bladder, and it gives it some very gentle stimulation. It's not painful. Most patients can feel a little bit of a vibration or fluttering sensation early on. Very, very quickly, they don't even realize that's going on. But that can really bring tremendous control to patients who've been having multiple accidents, wearing Depends, soaking through them on multiple points throughout the day, and all of a sudden we can begin to get the communication going the way it needs to and radically change their quality of life.